I first started noticing hair loss when I was around 23 years old. And by the time I was 25 years old, I was already in my master's program in psychology. And I started looking around, thinking about what I was going to do for my hair loss. It was early, but at that time, the only two choices you had was hair transplants using the punch technique or using a hairpiece. And I chose not to go with the non-surgical method. I went with the surgical method. Having the punch grafts stimulated my interests so much so that when I was accepted to medical school, instead of going into psychiatry, I decided to go into dermatology because I knew there was a better way of doing transplants than what we had at that time. And I think my psychology background really helps me in dealing with patients because I can empathize much better with them, having been a hair transplant patient, but at the same time being a psychologist, I can understand their angst and what they're going through. And you know, a lot of doctors are very, very uncomfortable with talking to patients, especially female patients. And I think that's where my strengths come out because of the fact that I can relate to them.